Greetings. Let me tell you something today. Some women, there are some women that will not be able to deliver their placenta after vaginal birth or even after CS. They will not, the placenta will refuse to come out. They call it placenta accreta. Placenta accreta. You know why? If they have their birth through the birth canal, right? If they have birth through the birth canal, you know what happens? They will not be able to deliver the placenta. They will not have to do surgery. And that surgery, most time, they will have to remove the whole womb. Because the placenta normally is supposed to implant into the mucosa of the womb. But this time, in this placenta accreta, the placenta we implant into the womb and extend into the muzzle. We get into the muzzle called the myometrium. It will eat into it, so it will be there. You will not be able to deliver it. And most time, they end up removing the womb of the woman. So it's very few women that survive keeping their womb after giving birth and they discover that they have placenta accreta. Good thing is that it can be picked during a scan. It can be picked during a scan. That's the good thing about it. Most women that have had placenta accreta, they are something called placenta percreta, where the placenta will even eat as far as the outside of the womb. I'll put some pictures up here. I'll put some pictures up here so that you will see the different types of placenta accreta. The placenta will eat so deep and deep and deep and deep into the womb that it will even extend outside the womb. You can be rest assured that such placenta cannot be delivered. So you see the baby will come out. After the baby has come out for this category of women, the placenta will refuse to come out. The person will now be carried from place to place. Most times, the womb will be removed to prevent too much bleeding. Because now it will now be time to save the woman's life. That's what everybody is up to now. The doctors will be interested in saving the woman's life. The baby is fine. They've delivered the baby. But placenta is refusing to come out. They call it placenta accreta. Nobody really know what causes it. The placenta will just attach so much into the womb, eats into it and extend it to the muzzle. Normally, it's not supposed to get to the muzzle that deep. It will extend to the muzzle, and sometimes it will get to the outside of the womb. Imagine such placenta will refuse to come out now. There are some women, if it is picked during scan, it can be picked during scan. That's why it is very important for you to do scan. Scan will tell you the position of the placenta and the attachment of the placenta. When you see your doctor telling you, go and do a scan. Some of you, since you got pregnant, scan you never do. If you hear your doctor, go and do. There are some certain things your doctor look at that you yourself you are not seeing. Yeah? You think they just want you to spend money. No. It is very wrong for you to be pregnant and you have not done a scan. Because that scan will help prepare you for labor. So some women that I've met, theirs was picked during scan. So they are normally told that, see, this is what we want to do. After the baby has come out, and most time it's CS they do for them. It's CS. Yes, CS is the best for them. After the baby has come out, we will try to see whether we can surgically. This time it's not the one you will not deliver natural, or that is the placenta will come out on its own. No. They need to cut. We need to see whether we can surgically remove the placenta and preserve the womb. But if we realize that you are bleeding too much, we just remove the whole womb. So women have delivered their first child and they lost their womb because of placenta accreta. ACCRETA. Placenta accreta. There's also placenta percreta. So that's how it is. So take note of this thing. So make sure you do scan when you are pregnant, so that you know. Placenta accreta is a very dangerous thing. It can happen in anybody. Anybody. This is different from low-lying placenta. This placenta is just eating deep into the womb. After you have delivered, placenta will refuse to come out. It will just be there. You will contract and contract, placenta will refuse to. I've seen some cases like that. Luckily, it's not very common in blacks. But I've seen some cases like that. After the woman will deliver in another center, they will now bring the woman to the teaching hospital that the woman has refused to deliver the placenta. That is, the placenta has refused to come out. The doctor will try and try and try and try and try. The placenta will not come out. They will now take the woman to theater. Lo and behold, it will be placenta accreta. So the woman, because the woman is bleeding. See, have you ever seen a woman that is bleeding after labor? It's not a good sight, too. It's a trauma to the doctor and the nurse. It's like tap. The woman is bleeding, and the doctor will have no option other than to remove the womb to save the woman's life. For your own baby. Your baby is fine somewhere. Your baby is fine. Every woman that gives birth to a baby must live to take care of that baby. Always have that at the back of your mind. So that's placenta accreta for you. Please, you can tell me if you have any experience, you have seen a case like that. You can put it in your comment section. Let's discuss. This thing is quite common. Quite common in some society, but not as common in blacks. A woman, you hear after the woman deliver, no fit deliver placenta. Now placenta we call the drag. Placenta no green come out. It can't they bleed. Something can't happen. Placenta accreta. That's why sometimes I am totally against home delivery. Somebody giving birth at home, no doctor there, no nurse there. You are just risking your life. There are some things you should not do. This is 2024. I know why I'm telling you all this. Yeah, thank you, and bye-bye. Please share this video. Please share this video so that it will reach a larger audience. Please, I beg you. If you watch this video, as the video comes in contact with you, like you just see it in your FYP, share it so that a lot of people, we want to educate a lot of our people so that they will know all these things. Placenta accreta is a life-threatening condition in pregnancy. Thank you and bye-bye.